So now we're going to do a technique of microneedling. We're going to be using the stem facial growth factor serum. The main ingredient here is mesenchymal stem cell cytokines. As you know, that's the biosignaling protein that signals the cell to regenerate. So this has the biosignaling proteins as the main ingredient. We're going to do quadrants. Now this isn't a roller ball, so it's just going to roll on. Of course, optimally would be supine, but here we're in a chair, but we'll work around that. Where do we set the pin? How deep do we go? The answer is whatever it takes. We're looking for an endpoint, like a laser. A minimum endpoint is going to be erythema. That's going to be a good endpoint. But if we're treating individual rhytids, if we're treating scarring, then we want punctate bleeding. So whatever it takes to get punctate bleeding, that's how deep we go. So we're going to start here at 1 millimeter. Now we're using a sweeping motion. How's that feel?
Good.
All right. We're going to go horizontally, we're going to go vertically, and then we're going to cross hatch. You can see we're starting to get erythema. And this is at 1 millimeter, guys, or providers. Okay, so again, we keep the pen moving, and we're using the serum, we're infusing it, and we're using it as a lubricant. So you can see how easily the pen glides using the serum. Now he does not have a glabella rhytid. Most people do, and that's where we're going to use a deeper penetration and a stamping motion. When you go over 1.5 millimeters, generally speaking, you want to use a stamping motion instead of a gliding motion. Okay, you can see we have nice erythema, little bit of punctate bleeding. It's a good treatment for what we're doing here. Now we do have some acne scarring here on the cheeks. We're only going to be treating these cheeks, the cheek area. We're going to increase the depth to 1.5. It's because of the torque. This is what I was talking about. You don't get this with every product. There are other good pens out there, but this is one of them. We want to break up that fibrous tissue. Okay, so they want to know what is the patient feeling, if you could ask him that. Ryan, how's that feel?
Good. It feels like I'm shaving my face.
He says it feels great.
Yeah. Doesn't bother me.
You see, I'm using a stamping motion or technique. Now we can also taut the skin if you need to. Okay, so this is for demonstration purposes, so I think you get the idea. So we're going to go to the other side. The whole treatment would normally take about 20 minutes. I'm actually going to increase a little bit, 1.7. Remember, the dermal-epidermal junction is about 1.5 millimeters. So we want to reach the dermal-epidermal junction to stimulate fibroblasts to create new collagen. One area of caution is under the eyes, and I would not do more than maybe 0.5 millimeters under the eyes. Also be careful of the décolleté, because it doesn't have the sebaceous glands that you have on the face, and we don't get the same amount of healing that we do on the face. Who can we do microneedling on? Is there any limitation? Any skin type, because we're not using heat. We are not disturbing the melanocytes. There should be no PIH. Of course, and I'm sure in your training manual, you want to wait a minimum time after use of Accutane. Some people say 6 months, some say a year. Doctor, I'm not sure what you would...
6 months. Yeah. As long as the acne is not active, yes. If it's active, then you need to treat with antibiotics, and once it's not active. They're asking about the treatment of acne, so the answer is, as long as it's not active, you make sure that if it's active, you treat it with antibiotics, and then you go in and treat with this after you have treated it with your antibiotics. With pustules, that they have active pustules.
Okay, I'm just going to show you briefly how to treat under the eyes, and you want to taut the skin.
Now, you lower the decimal concentration, right?
Yes, we're at, now we're at 0.5 millimeters. You want to taut. So the sensitive areas are the upper lips and the nose. You also want to taut the nose. And it does tingle. It makes them want to sneeze, but they don't. I'm now 1 millimeter. And you can see we're getting nice erythema, a little bit of punctate bleeding. That's good. That's all we need. Of course, we will also do the neck. He has a beard, so I'm probably not going to microneedle over the beard. So for demonstration purposes, I think this will give you an idea.